another video for you guys. Before I get started, make sure you go ahead and like, subscribe, and please put a comment on this video. That helps me to make more videos. And if you have something that you would like me to talk about, please leave that in the comments as well. I wanted to talk today about the aesthetic procedures that I love doing. So this, if you're in the med spa industry or looking to be in the med spa industry, maybe these are some procedures that you would like to offer in your clinic as well. I just wanted to talk about some of my favorites, and hopefully my earring isn't bumping up against my microphone, which I think it is. But first, we'll start off with PDO threads. I love doing PDO threads, not only because you get that instant gratification, but it's fun to do. What PDO threads are, a thread, think of something like a suture, and the ones that I use, they're long, so they're about this in size, and they have little barbs. Now, when I say this, it sounds really barbaric, but they have little tiny barbs on them that are molded onto the onto the thread, right? So imagine a suture, like you were getting surgery and you're getting something sewn. They're like a suture, so made of that material, and they have these little threads that go in the skin. We put them in via, we make a little port site, and it has a cannula, and we take this thread that has these little barbs on it, and what it does is when it goes under the skin, and you have to be into the right plane, which you learn when you go to training, but you have to be in the right plane of the face. And what I love is once you're in the right plane, it glides like butter. You might have to go through, you know, a little bit of tissue, some dense tissue or something like that, but you just go through and it glides like butter. You get into the right spot, and then those barbs kind of attach to your tissue, and then when it does that, it attaches and we can pull it, and it literally pulls. So if you do this in the mirror, that's kind of the look you get with threads, right? So we can do threads to give you a cat eye or a fox eye, which is pretty popular. More so the young people, they love that fox eye look. And then we can put threads to pop out the cheekbone. We can put threads to, if you have some jowling, which jowling is when it gets, because we all age, right? So once we age, we lose collagen, we lose fat, and our skin just gets more lax, and it starts to, that's why, you know, you'll see people start to get, their smile lines are worse and their skin just starts to kind of sag. That's because we've lost that collagen and fat that we have when we're youthful. So what the thread does is it takes that loose skin and it just tucks it back up. Now, the good thing about threads is that what it does when we put the thread in is that our body starts to form collagen around that, because when we heal ourselves, so the body kind of notices the thread as not an invader, but it notices the thread as injury, so it starts to build collagen around. Now think of collagen as like shrink wrap, right? So it's going to pull and it's going to tighten. So it's going to pull and tighten that skin. So the thread eventually disintegrates. The thread lasts about 6 months, and then it starts to dissolve, right? But around it, your body has built up that collagen, which ends up taking the place of the thread, and it tightens and keeps that same tightness and induces collagen, which we also lose as we age. So when you induce that collagen, then it helps to plump that area back up, and it basically takes the place of the thread. So I love threads because it's instant gratification, right? And we can really pull back and snatch back that skin. We could do reverse threads where we actually tighten up that jawline, make that snatch, pop that cheekbone, put that eye up. We do neck threads. There's also another thing called smooth threads, which that's a whole other subject, but that just goes, and if you have like little wrinkles, or say I do a lot of smooth threads around the lip, because it could build the collagen, which could make that the border of the lip pop a little bit more. So I love doing threads because I call it a non-surgical facelift, right? So can you imagine getting that and just, you know, giving you that old youthful look that you used to have, right? Just pull it back a little bit, make everything snatched. Love, love, love doing threads. Next is microneedling. Love doing microneedling because what microneedling is, it's a machine that we use, and it basically goes over the skin and it makes tiny abrasions. When it makes that those abrasions, it again induces collagen growth, which collagen makes your skin tight, firm, youthful looking. So we make small abrasions using, it has microneedling, so it has micro needles in the machine, and we just glow over the skin. You may have heard a trademark name, you know, that character that likes to suck people's blood, that facial. It's been trademarked, so I don't want to say to get in trouble, because you have to take this one specific doctor's class to be certified to actually give that kind of facial, but essentially it's the same thing. But we're making tiny abrasions with the microneedling machine, and then we can go ahead and infuse your skin. So I use a CBD cream that helps with inflammation and helps with rebuilding that skin, and then I use other serums, and then we do a face mask, and we do a nice wash, and it's just really nice. But the great thing about microneedling is it sloughs off that dead layer of skin, and it really makes your skin feel tight. We recommend that you get 3 treatments, but I've had 1 so far, and I love the results, so I can't wait to get my second. It's kind of, I got it in the beginning of summer, and you know, your face does feel, after you get it, it feels like sunburn and really tight. So I've just been trying to not do that in the summer, but now that it's heading back into fall, I'm definitely going to do another one, because it literally, like, my whole face started to peel, turn black because it was dead. So it turned, you know, black, and you could just see the layer of skin sloughing off. And then after a couple weeks, your skin, it's about 7 days downtime. And when I say downtime, I use that word loosely, because you're just peeling, and again, it's a little spicy on the face. Your face feels a little sunburned for a few days, but after that it goes away. So I love microneedling because of the great results that you get from it, and the new skin that reveals itself after you're done. Third is Botox treatments. It's still one of my favorite treatments to do, especially for newbies, because when they go from not having wrinkles, like my one friend said, I completely took her ugly away, even though she's beautiful. I completely took her ugly away just by doing Botox. And I love Botox because just by doing Botox, it can do so much for your face, right? Taking those wrinkles away. And you might say, you know, I'm not even talking to the people who are like, who cares if I have wrinkles? I don't care. Okay, if you don't care, then you don't care. But if you do care, and you just want like snatched tight skin when you put your makeup on, you know, when you wear your makeup and you might be going throughout the day, and then you see it like caking up in certain spots, that's because of the wrinkles. But when you do toxin, I use Dysport, that's the one that I like, but Botox is a popular name. When you do toxin, then it just takes that away, makes your skin like tight and shiny, and that mixed with microneedling is just amazing. We can also do, I also do microneedling with PRP, which is platelet rich plasma, where we draw your blood, spin it down, get those platelets, which really help regenerate your cells quickly, and we infuse that into the face, into the channels that we make with the small microneedling pores. We can also put Botox in those pores as well. I haven't tried that yet, but I hear it's great, so I might try that on myself. But you put Botox, so you do the anyways, I'm getting back to microneedling, but it's microneedling and toxin, so it's fine. But love, 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 especially if you're a starter, just go get you a little Botox, see how you feel, start there, and then you can work your ways up to other treatment. Lastly, my bonus is I love skincare, because as a practitioner who does toxin, I can only do so much, right? I can put a pretty bow on the wrapped gift, which is your skin. Botox is a pretty bow, and you know, it's a nice icing on the cake. But if the cake tastes nasty, or there's a horrible gift wrapped in a beautiful wrapping, then really, what are we doing here, right? So that's why it's so important to me that my clients get on a good skincare regimen, because getting your skin taken care of from inside out is really most important. And then I come do my magic with the tox and the microneedling, and it just enhances the whole treatment. But skincare is the most important. If you're not on a skincare regimen, especially if you're in your 30s, and definitely especially if you're 35 plus, you need to be on a skincare regimen in which you are doing at least a good wash, a good toner, or some pads to really help you get that exfoliation and the extra cleansing on the face. Because I don't know about you, but if you ever wash your face and then you go in with a pad, you see that you've left a lot still on your face. So you want to go in with your wash, and then you want to do either some cleansing pads or a toner, and then you want to do a serum, and then you want to do a hydrating cream, and then you want to do an SPF minimum. You have to do that. You have to do that. And yes, I rave about medical grade skincare, because I just feel it's the best, and it works fast, and it gives you a big bang for your buck. And it's really rewarding when you start seeing your skin change and you start seeing those improvements. Then it influences you to do it more. So that's why getting under a good skincare regimen is key. So I hope you learned something from this video, either about possible procedures that you can offer in your clinic, or if you're a patient looking for popular procedures and wanted some information, then I hope you got something out of that. So again, I'm Crystal Parker, owner of Savvy Beauty and Wellness, where I specialize in all things IV hydration and aesthetics. Hope you learned something from this video. Make sure you like, subscribe to the channel, and turn those notifications on so you know when I drop my next video. Have a great day.